Right now in Chicago, the total number of confirmed cases of COVID-19 is doubling about every 3 to 4 days. Our capacity for cases is still well ahead of demand for now, but it's truly a race against time.
The mission here was to maximize the capacity in McCormick Place for COVID-19 patients. We had less than 30 days to provide the city and the state with as much overflow capacity as we possibly could.
Within the first week, I think we had 500 beds up and ready. The next week, we had another 750. And then finally, in 26 days, we had almost 3,000 beds ready to go.
We had to accomplish that mission, and the way that we approached it was to get the right people in the room at the same time. And we were planning, we were designing, we were constructing at the same time as the clinicians and the city of Chicago were trying to figure out how to equip it, how to put supplies into it, and then staff it and operate it.
So on day one, that Sunday afternoon, we determined a chain of command. We also had to make sure that the people that we were dealing with had the authority to say yes or no. Walsh immediately put Tom Kaplis in charge. He had full authority.
So the decision-making process wasn't through a project manager to a senior manager to, somebody who runs a program and then up to a president or a CEO. It was me and the CEO making a decision and moving on.
Communication is key. When people aren't communicating, that's when projects stall. That's when things break down.
Our daily integration meeting, that is the place where people can freely speak up and express any concerns and how to move forward. So it's just been a great example of a unified team effort to get the right results.
26 years of military service, I'm not sure I've been involved in an effort where everybody came together so quickly, purely focused on the outcomes. Not so worried about the process or who got credit or who was doing what, but purely focused on delivering on the outcome.
It wasn't just Walsh, it wasn't just the Corps, it wasn't just the city, it wasn't just the Illinois Department of Public Health, it wasn't just the Air National Guard. It was this massive team that came together of doers.
At the time when we started this, we were extremely fearful that our hospitals were going to be overrun, and time was absolutely against us. And so the Illinois Guard launched 2 C-130s out to Oregon to pick up 250 of these isolation pods, saved 2 to 3 days of transit time, 2 to 3 days of construction time to get them moved out here. But the partnership again between the Illinois Guard, our contractors, the police, the fire departments, all that came together out there that night, that was pretty inspiring.
I think this is the greatest city in the world. The last 25 days have only magnified that for me. I wish I could walk everybody through this space. I wish I could have shown the level of pride in the work, in the craftsmanship, the team spirit that took place here. Mayor Lightfoot, Governor Pritzker had toured this facility many times, and the first time that they came up to me personally and said, "What do you need?" And the city and the state absolutely stepped up with the right resources from the highest level to help us accomplish the mission.
We say Chicago is the city that works. I think this is a prime example of the city that works. Chicagoans, when they need to step up and they get the job done. And this is a great example. Makes me very proud.